Hello, everyone. My name is Hailey, and this evening we'll be discussing dental health in children. I hope everybody's having a lovely evening so far. I'll just wait a couple minutes just to make sure everybody has a chance to get on, and then we will begin. All right, as it's 7:01, we're going to get started. So, like I said, tonight we will be discussing dental health in children and why it's important. So, why is it important? Well, teeth help us eat, smile, and talk. And since we're talking about children, baby teeth actually help for the placement for adult teeth. If baby teeth follow too early, the permanent teeth can grow in too early and cause something called crowding. So the adult teeth grows in and pushes those baby teeth to the side, and this can cause serious issues for children. So another reason why dental health is important is because it keeps your child's teeth healthy and clean and prevent long-term issues such as mouth pain and cavities, which we will be talking more about, and ultimately help you from spending more money on dental care. So when should kids start brushing their teeth? Well, good dental care actually begins before a baby's first tooth appears. Just because you can't see the teeth doesn't mean that they aren't there. So teeth begin to form actually in the second trimester of pregnancy. At birth, your baby has 20 primary teeth, some of which are fully developed in their jaw. And even before your baby starts teething, what you want to do is you want to run a clean, damp cloth over the gums to help clean the mouth after feeding. So I have a cloth here, and from what I've learned, the best technique is just to wrap the cloth around your finger pretty tightly, and you're just going to want to dampen it a little bit. And you're going to want to rub the cloth over their gum line and then just in the buccal area, so right in their cheeks, to get all of that bacteria out of there after they're done feeding. So baby teeth, when do those usually come in? Well, they usually come in around 6 months of age. When your baby gets teeth, you want to brush them with an infant toothbrush. So you want to use water and a tiny bit of fluoride toothpaste. So for children under 3 years of age, about the size of a grain of rice or the width of the toothbrush. And once your child knows how to spit, which is usually around the age of 3, you can start, I apologize, I have a baby cat here. So once your child knows how to spit, usually around the age of 3, you can start using a pea-sized amount. And if possible, use a fluoride toothpaste, as fluoride ultimately strengthens their teeth and helps prevent cavities. So a fun fact about fluoride is it's actually found in our tap water in many areas around us. And when 2 of your baby's teeth start to touch, you can start flossing them. So just a little note on this generally, that you should try and supervise kids younger than 8 while brushing to make sure that they're getting all around their gums, doing a good job, and not just swallowing the toothpaste. So what is a cavity? Well, cavities are permanently damaged areas to the hard surface of your teeth that develop into tiny openings or holes. And cavities are also called tooth decay or caries and are caused by a combination of factors, including bacteria in our mouth, frequent snacking, and sipping on sugary drinks, and of course, not cleaning your teeth well. So cavities and tooth decay are actually among the world's most common health problems. And they're especially common in children, teenagers, and older adults. But anybody who has teeth can get cavities, including infants. So if cavities aren't treated, they get larger and can affect the deeper layers of our mouth. They can lead to severe toothache, infection, and even tooth loss. So regular dental visits and good brushing and flossing are habits that provide the best protection against cavities and tooth decay. So what am I looking for? Well, the signs and symptoms of cavities definitely vary depending on the extent and their location. So when a cavity is just beginning, you might not have any symptoms at all. But as the decay gets larger and larger, it may cause signs and symptoms. And some of these signs and symptoms include toothache, spontaneous pain, or pain that occurs without apparent cause. Tooth sensitivity, mild to sharp pain when eating or drinking, something sweet, hot, or cold, visible holes or pits in your teeth, black, brown, or white staining on the surface of the tooth, and pain when you bite down. So early tooth decay looks like a white spot, and these are the early tooth decay, okay? So these can be reversed if they're found early. But advanced cavities can look like dark stains. So I've actually got some images to show you what you can look for. So here, hold on. See if that, okay, there we go. So you can see, oh my goodness. You can see, there we go, perfect. So at the top there, you can kind of see some white deflections there. And what those are the early cavities. So these are the ones that can be reversed. And I have a picture here of the more advanced cavities. As you can see here, there's some brownish stains along the top teeth there. And you can even see some pits in there. And then this is a picture of very advanced cavities. As you can see that they've really taken a toll to the child's tooth and really started to erode it. So how does tooth decay develop? Well, first a plaque forms. And the plaque is a clear, sticky film that coats your teeth, like the first picture that I showed you. And it's usually due to eating a lot of sugars, starches, and not cleaning your teeth well. And when sugars and starches aren't cleaned off your teeth, bacteria begin to quickly feed on them and form a plaque. And this plaque stays on your teeth and can harden either under or above your gum line into something called tartar. And this tartar makes the plaque more difficult to remove and creates a shield for the bacteria. So the acids in the plaque remove minerals on your tooth's hard outer enamel. And your enamel is what protects your teeth. So this erosion causes the tiny openings or holes in the enamel, like at some of the pictures that I just showed. And this is the first stage of cavities. So once these areas of enamel are worn away, the bacteria and acid can reach the next layer of your tooth. and that's called dentin. And this layer is a softer layer than the hard enamel layer on the outside. And it's less resistant to the acid that the bacteria makes. The dentin has tiny tubes that directly communicate to the nerves in our teeth that causes sensitivity. So as this destruction continues and the tooth decay develops, the bacteria and the acid just erode your tooth, moving on to the innermost layer. And that contains your nerves and blood vessels. So the inner layer becomes swollen and irritated from the bacteria. And because there's no place for the swelling to expand inside that little tooth, that nerve becomes compressed. And that's what causes the pain and discomfort. And this discomfort can even go right outside to our tooth, right into our bone. So, common risk factors for cavities. So, like I said, everybody that has teeth has a risk of getting cavities. But some of the following factors that I'm going to mention can definitely increase the risk, such as the tooth location. So, decay most often occurs in your back teeth. And these are your molars and your premolars. These teeth have lots of grooves and pits in them, and multiple roots that can collect food particles. So as a result, they become harder to keep clean than your smoother, easy to reach front teeth. So I just got a little picture here, because some of us don't look at our teeth every day. So here you see an average child's mouth, and you can see in the back here, these are your molars. And you can see all the cavities that the little pits that they have in there. So you can see how the food that we eat and the sugar that we consume can get easily stuck in those areas compared to the front teeth, which are don't have as much grooves in them. A lot easier to keep clean. So certain foods and drinks, foods that cling to your teeth for a long time, such as milk, ice cream, honey, sugar, soda, fruit, chips, are more likely to decay our teeth than the foods that are easily washed away by saliva. So another thing that can cause cavities is the frequent snacking or sipping. So when you steadily snack or sip on sugary drinks, you give the mouth bacteria more fuel to produce acids that attack your teeth and ultimately wear them down. And sipping soda and other acidic drinks throughout the day helps create a continual acidic environment that basically bathes your teeth. Bedtime infant feeding is also a very important thing that is a high risk factor. So when babies are given bedtime bottles filled with milk or formula or juice or other sugar-containing liquids, these beverages remain on their teeth for hours while they sleep. So feeding decay causing bacteria. So this damage is often called baby bottle tooth decay. Similar damage can occur when toddlers wander around drinking from a sippy cup filled with their favorite beverages all day, or when they're given a sippy cup to go to bed with. And bacteria, they love sugar, they love a dark, moist environment to grow in. Another risk factor is inadequate brushing. So if you don't clean your teeth soon after eating or drinking, this plaque forms quickly, and the first stages of tooth decay can develop. Another risk factor is not getting enough fluoride. So fluoride is a naturally occurring mineral, and it helps prevent cavities and can even reverse the earliest signs of tooth damage. And because of its benefits for teeth, like I had mentioned, fluoride is added to our public water supplies. and is also a common ingredient in our toothpaste and our mouth rinses. But bottled water usually does not contain fluoride. So, how can we prevent cavities? Well, don't put your baby to sleep with a bottle or a sippy cup, unless if it's just water. Because like I had mentioned, even babies can get tooth decay. So putting a baby to sleep with a bottle can harm their teeth from sugars in the juice, formula, and milk. And when you put them to sleep, this bacteria remains on their teeth for the hours that they sleep. And like I said, it can result in baby bottle tooth decay. You can also eat healthy, so limiting the amount of sugars that you consume in sugary drinks. And of course, brush and floss your teeth. Very important. Another thing you can do is check your child's teeth often and look for those early signs, such as those white plaques that I had shown, or the brown, black tooth decay. If you see any of these signs, it's very important to take your child to a dentist to hopefully get this removed and hopefully reverse that process. So when should we bring our child to a dentist? Great question. Well, it's actually recommended that you bring your child to the dentist for their first appointment by 1 year of age. So another important topic that I'd like to talk about that relates to child teeth is, what do we do when a tooth is knocked out? Because children, as we know, are very active little people, and it's often that whenever a child falls or is in contact sports, the face is affected, so their teeth can be affected. So what do we do? Well, if a tooth just gets chipped, what we're going to do is gather up those broken pieces and we're going to take them to the dentist for repair. But if the entire tooth has been knocked out, it's important to act very quickly and carefully to increase the chances of saving that tooth. So what are we going to do? Well, what we're going to do is we're going to first confirm if this tooth that's been knocked out is an adult tooth or a baby tooth. And that's an important first step because baby teeth are not re-implanted, but adult teeth are. We're never going to touch the tooth by the root because the root contains fibers, and those are called periodontal ligaments that are necessary for proper healing. So we want to handle that tooth by the chewing surface of the area. So in this picture, that means the top surface. So here, the very top surface, so we don't damage the root of the tooth. If the tooth is soiled, we want to briefly just rinse it with some water, but we don't want to scrub it because we don't want to risk damaging that tooth. And then we're going to immediately put the tooth back in the socket, so wherever the tooth came out of, if possible. Now, this may not be an easy thing to accomplish, but if you can, we want to try and hold it there with a clean gauze or a washcloth. And if we can't put it back in, we want to place the tooth in a clean container with cold milk or the child's saliva. But we don't want to put it in water because water will actually erode the tooth. And then we want to head straight to the dentist or the emergency department, taking that tooth with us, and hopefully they'll be able to take the tooth and re-implant it. So the importance of timely action. Well, time is a very important factor for the survival of the tooth. If the tooth is replaced into the socket within 5 minutes of being knocked out, it's likely that the tooth will survive. Between 5 and 60 minutes, there continues to be a good survival rate as long as the tooth has been stored properly using those techniques that I had mentioned. But if the tooth is out of the mouth for more than 60 minutes, the chance of survival decreases significantly. At the dentist office or the emergency department, the tooth will likely be reimplanted and splinted to the adjacent teeth for 2 to 8 weeks. So, protection is also key in these situations. Despite the best methods for us saving the tooth from a tooth that's been knocked out, it's clear that prevention is definitely key. So when playing contact sports, it's recommended that a mouth guard is worn. Now you can get your mouth guard from your local dentist, or you can actually buy these quite frequently at different sports stores, or even Walmart usually carries them. So, how do we teach good oral habits to our children? Well, start early. So to start, scrub their teeth and gums gently with a clean, soft washcloth when they're infants. So again, just going to show you the cloth. And a good technique is take your finger, wrap it in the cloth, and just dampen it with some water. We don't want to soak it. And this is getting children used to having their mouth cleaned from the start, so it makes it easier for them to brush their teeth every day. Once they're old enough to understand what you're doing, you can talk to them through the entire process. And they'll find that brushing their own teeth more enjoyable and exciting once they've learned how. Especially if it makes them feel like they're grown up, because they become accustomed to brushing properly. And at this point, you can also teach them how to floss. Second thing you want to try and do is lead by example. Remember, good dental hygiene habits start with you. If children see you brushing and flossing twice a day, they're more likely to want to follow suit. You can also make sure that this looks enjoyable and fun. Children like to mimic adults, so you may see them promptly brushing their teeth in no time. Encourage healthy eating. Like I'd mentioned before, try and limit those snacks, sugary drinks, to more healthy choices. Have fun with it. It's a good idea to let children pick their own toothbrush, toothpaste. There's a wide variety of kid-free friendly products that can make children feel a bit more excited about brushing their teeth. So for instance, I know that they make a wide variety of flavored toothpaste specifically designed for young children. So kids will likely want to run to the bathroom to use their new favorite strawberry watermelon flavored one instead of the mint. And lastly, you want to try and pick a suitable dentist that not only your child will like, but you as well, because it will ultimately make both your and your child's experience more enjoyable. So some strategies to help make brushing a little more fun. So 2 things that I came up with is create a reward system for your child. You can add a sticker to a chart or use a calendar. And you can place 1 sticker in the morning and 1 for at night, or even get your child to try and place a sticker on the calendar or chart. And maybe when they've reached a certain amount of stickers, you can do something fun together. Another cool idea is you can sing a song before you brush your teeth together or after. So the song that I found is, I brush my teeth, morning, noon, and night. I brush them, floss them, rinse them clean, I keep them nice and white. I brush them once, I brush them twice, I brush them till they shine. And I just thought that was a really fun, a great way to interact with your child and get them excited to brush their teeth. So that concludes our little information session on dental health in children. I hope that everybody enjoyed that. I've actually gone ahead and created a little pamphlet for you guys that you can refer to now or later with some of the key topics that I had mentioned. So what I'm going to do is after I conclude this session, I will drop that in the comments for all of you to view. And before I go ahead and log off, I have 2 trivia questions. Oh, I'm getting some great comments in the chat. Awesome. Awesome. So glad that you guys enjoyed. So before I log off, I've created 2 trivia questions that I hope that everyone will participate and answer. So how long should we brush our teeth for? Go ahead, take your best guess. If you don't know, that's okay. So it's actually 2 minutes. So we're supposed to brush our teeth for 2 minutes in the morning and at night. And the second question I have is, when should we replace our toothbrush? When do you guys think we should replace our toothbrushes? Oh, great guess. Great guess. Yeah, so when our brushes are worn or every 3 to 6 months. There we go. Yeah. So collaboratively, you guys definitely got that. Awesome. So I'm going to go ahead now and just drop my little pamphlet in the chat for whoever wants to view that. You know what, I will do that after, because I don't think I can do that while I'm on video. Well, thank you everybody for coming to take a listen. I hope you guys learned some new and exciting things, and the strategies that we had discussed will help you engage with your child and get them excited to brush and floss their teeth. Have an amazing night, everyone. Take care.